For Chapter 10, Delegation, Leadership, and Management. Our theory objectives here are listed below on this slide. We're going to differentiate between the three different leadership styles, compare and contrast examples of effective and ineffective communication, describe 4 characteristics of an effective leader, and list 4 considerations for delegating tasks to UAPs. Then for our clinical practice objectives, we are going to determine the leadership style of the charge nurse on a unit to which you're assigned, and also appropriately delegate 3 tasks to a nurse's aide or a UAP. Each organization has a defined organizational structure that identifies the working hierarchy. Each level or role within an organizational structure has different responsibilities inherent in that role. Each level of an organizational structure is dependent on the others in order for the entire organization to function effectively. In your place of employment, how many levels of management are above you? How many are below you? And everyone's answer here is going to be a little bit different. In the laissez-faire style, the leader allows complete autonomy, and the group makes its own decisions. In the autocratic style, the leader makes all the decisions, usually alone. In the democratic style, the leader allows decisional input and some control. Most leaders use a blend of leadership styles. A good leader instills confidence, trust, and spirit into the team. Appropriate leadership fosters growth among the team members. Leaders who exhibit most of these skills instill trust and confidence in the staff. They are viewed as mentors rather than bosses. They inspire the staff to work together as a team and motivate the team effectively. Have you ever worked for a leader who has all of these qualities? How did you feel working in this environment? It is important to collaborate with others in the healthcare work environment. Is it important to collaborate with others in your healthcare environment? Of course it is. Life and death decisions are being made and executed, so it's vital. What are some potential consequences in the lack of collaboration within a healthcare team? Well, you can see treatment errors, patient complications, increased mortality, and increased costs, plus many more. How can you establish a pattern for two-way communication? Obtaining feedback about directions given and listening actively and mindfully to reports, suggestions, and complaints establishes a pattern for two-way communication. Communicating effectively includes taking the time to attend to the person by stopping what you're doing, establishing eye contact with the other person, remembering to be polite by saying please and thank you, and using a warm tone of voice. Verbal and nonverbal communication are important in order for the leader to be effective. If your facial expression is not consistent with your verbal message, this will confuse the person receiving the message. As a nurse leader, you must demonstrate competence in the skills of the profession. Knowing the strengths of each member of the healthcare team helps you more effectively divide the workload. Problem-solving skills provide the means by which difficult decisions can be made. What are some potential consequences of individual staff member disorganization? Well, that could be missing important details that affect care, such as medication dosage changes, abnormal labs, things of that nature. The LPN must know what skills the unlicensed person can do before delegating those skills to that person. Many states do not allow licensed practical vocational nurses to delegate, and even in a state where it is allowed, you must also be certain that delegation is allowed in your facility of practice before performing it. Elements of effective delegation include clear communication of the task to be performed, patient identification, time frame, mechanism for reporting task completion, and results. Is this an appropriately delegated task? Don't forget to empty the urine drainage bags. Why or why not? No, it's not, because the patient, time frame, reporting mechanism are all very unclear. Before delegating a task to a UAP, you should verify competence to perform the task. There should be written documentation of the task or skill competence at the unit level or organizational level. A list of skills and tasks for each staff member should be readily available in case questions arise about roles and responsibilities. If you delegate a skill to a UAP, it is not performed at all or is not performed correctly, you are still responsible for getting it done correctly. What do you do if the situation warrants disciplinary action? Well, you're going to discreetly discuss the situation with the charge nurse or the nurse manager for follow-up. 1. Jackie is working in a hospital setting. Her charge nurse does not attempt to take control of the unit and offers little direction. Jackie is a new graduate nurse and finds this difficult at times. She knows that this is what type of leadership style? Laissez-faire, autocratic, democratic, or appropriate? It's going to be 1. Laissez-faire. A permissive or laissez-faire leader assumes members of their team are competent and self-directed and will do what needs to be done correctly and efficiently. This leader often has a need to be liked by everyone and avoids blame for things that go wrong. 2. Denise works in a hospital where her charge nurse consults her staff and seeks participation in decision making. What type of leadership style is Denise's charge nurse exhibiting? Laissez-faire, autocratic, democratic, or appropriate? This is going to be 3, democratic. In a democratic leadership style, team members are respected as individuals and there is an open and trusting attitude overall. Number 3, Mimi is working in a busy physician's office. She must delegate certain tasks to other team members working in the office. When delegating tasks, she realizes it's important to do all of the following except: Number 1, avoid being accountable for the tasks she delegates to others. 2, treat others in the manner she prefers to be treated. 3, be very specific about what needs to be done. Or 4, be specific when tasks are to be completed. So the answer is number 1. You are accountable for the tasks you delegate. Legally, as a licensed nurse, you are responsible and accountable for the outcome of any tasks that you delegate to another person. So the next section of Chapter 10, we have some more objectives for the theory portion. We're going to explain why interpersonal relationships are important when delegating and managing to others, compare and contrast skills and functions of the team leader and with those of the charge nurse, identify management functions of the LPN working in the long-term care facility, home care, or outpatient clinic, discuss techniques of effective time management, and explain the importance of the readback for verbal or telephone orders. And for our clinical practice objectives, we're going to create a time-efficient work organization plan for a shift, demonstrate proficient use of the hospital computer, accurately and carefully acknowledge orders per facility policy, Document accurately for reimbursement. Know your facility's policies and procedures and uphold the standards of nursing practice. And find a mentor who can coach you on improving your delegation and management skills. So, leadership roles. A team leader coordinates and makes assignments for other personnel, assists with patient care, helps resolve conflicts, assists with the writing of policies and procedures, contributes information for evaluation of UAPs, and collaborates with physicians and other health team members. In a long-term care facility, the charge nurse receives the report from the previous shift, makes patient assignments, makes rounds and assesses all patients, directs the administration of medications and treatments, confers with team members throughout the shift, and reports to the oncoming shift on patient status. All of these skills are essential for effective delivery of care and all fall within the scope of the LPN practice role. Effective time management requires good organizational skills. Documentation is a critical task in all settings and must be considered a priority to be done as soon as possible when organizing to accomplish the daily workload. The nurse must become proficient in using a computer in order to perform everyday functions for patient care and unit administration. Many hospitals are adopting totally computerized patient records, including medical orders. Nursing documentation, so nursing notes, flow sheets, all of that, and incident reports are all included in the EHR, electronic health record. Transcribing orders requires concentration and diligence. This is difficult with a busy, noisy environment. What should you do if you think a physician's order is unclear? Well, you have every right to clarify any unclear order directly with the ordering provider. So asking a physician to repeat something is perfectly acceptable. What could happen if a stat order is missed completely or not transcribed as stat? Well, depending on the order, it could result in a grave consequence for the patient. What could happen if an order is not checked off when it is transcribed? The patient could end up getting duplicate medications, labs, procedures done, etc. Besides creating a potential risk to patient well-being, costs are also driven up. The practice of taking verbal and telephone orders can be unsafe unless carefully performed. Again, it is important to understand the Nurse Practice Act in your state as well as any additional limitations imposed by your organization. It is difficult to recover costs for equipment, supplies, etc. if they are not charged correctly to the right patient. The organization must then cover these costs, which affect revenues and productivity measures. Facilities may use MDS coordinators to ensure correct completion of all required forms and appropriate reimbursement for Medicare patients. Poor documentation may lead to fines imposed by the Department of Health and Human Services as well as a decreased reimbursement. Risk management is every staff member's responsibility to execute. Does risk management apply only to your assigned patients? No. Potential risks to all patients, visitors, and staff should be minimized when they are evident within the work environment. Question number 4. As a charge nurse in a long-term care facility, transcribing written orders is a daily task. When transcribing written orders, it is important to remember: 1. Stat orders should be taken off within 24 hours. 2. To check off each order prior to discharge of the patient. 3, allergies are important and the nurse should memorize all patient allergies. Or 4, all orders written preoperatively are considered canceled at the time of the patient enters surgery. The answer is going to be 4. Brand new orders must be written in their entirety for a post-surgical patient. Stat orders should be taken first and as soon as possible. The nurse should check off each order as it's transcribed, not at discharge. And allergies are noted on the MAR sheet and on the chart to alert all personnel. There's no way you're going to be able to memorize all the patient's allergies, especially if somebody has a lot. Question number 5. Janice, a new LPN, wants to make sure she is taking telephone orders properly. She knows it's important to do all of the following except 1. Have a pen ready and the patient's medical record open to appropriate page to accept a new physician order. 2. Write the order as close as you can remember to the physician's order. 3. Document the date and time and indicate TO for telephone order with your first initial, last name, and LVN or LPN. Or 4. See that the physician signs off on the order when making rounds within 48 hours. So the answer is going to be number 2. The nurse should write the order verbatim. That means word for word as it is given. The nurse should read it back to the doctor to make sure it's correct and verbatim.